MonoMAC. MonoMAC syndrome is a rare autosomal dominant syndrome associated with monocytopenia, B and NK cell lymphopenia, mycobacterial, viral, fungal, and bacterial opportunistic infections, and virus infection-induced cancers. The disorder often progresses to the development of myelodysplasia, myeloid leukemias, and other types of cancer. MonoMAC is a life-threatening and precancerous disorder. Inactivating mutations in one of the two parental GAT-ATWO genes is responsible for the many diverse presentations of a genetic disorder. These autosomal dominant mutations are known or presumed to cause a reduction, i.e., a haploinsufficiency, in the cellular levels of the gene's product, GAT-ATWO. The GAT-ATWO protein is a transcription factor critical for the embryonic development, maintenance, and functionality of blood-forming, lymphatic-forming, and other tissue-forming stem cells. In consequence of these mutations, cellular levels of GAT-ATWO are deficient, and individuals develop over time hematological, immunological, lymphatic, and/or other disorders that may begin as apparently benign abnormalities but commonly progress. MonoMAC is a presentation of GAT-ATWO deficiency that involves primarily signs and symptoms of immune deficiency that cause an extremely high susceptibility to infections and infection-induced benign and malignant. In addition to this, however, MonoMAC-afflicted individuals often show one or more signs and symptoms of other GAT-ATWO presentations. MonoMAC was first described by Witt and colleagues in 2010 as an autosomal dominant familial disease. 1 year later, Dickinson and colleagues discovered that the MonoMAC disorder in 4 individuals was associated with any one of 4 different mutations in the GAT-ATWO gene. Subsequent studies identified numerous other GAT-ATWO gene mutations that are associated with the development of MonoMAC showed that these mutations inactivated or were considered likely to inactivate one of 2 parental GAT-ATWO genes and found that essentially all individuals with MonoMAC had one of the mutations known or considered to inactivate GAT-ATWO. Signs and symptoms. This syndrome is characterized by an increased susceptibility to disseminated non-tuberculous mycobacterial infections, viral infections, especially with human papillomaviruses, and fungal infections, primarily histoplasmosis and molds. There is profound monocytopenia, B lymphocytopenia, and NK lymphocytopenia. Patients have an increased chance of developing malignancies, including myelodysplasia/leukemia, vulvar carcinoma, metastatic melanoma, cervical carcinoma, Bowen disease of the vulva, and multiple Epstein-Barr virus plus leiomyosarcoma. Patients may also develop pulmonary alveolar proteinosis without mutations in the granulocyte macrophage colony stimulating factor receptor or anti-granulocyte macrophage colony stimulating factor (AUT). Last, patients may develop autoimmune phenomena, including lupus-like syndromes, primary biliary cirrhosis, or aggressive multiple sclerosis. Of the 26, now 28 patients probably afflicted by this syndrome, 48% died of causes ranging from cancer to myelodysplasia, with a mean age at death of 34.7 years and median age of 36.5 years. Genetics. 12 distinct mutations in the GAT-ATWO gene have been identified. They include missense mutations affecting the Zinc-Fingerminus-2 domain and insertion/deletion mutations leading to frame shifts and premature termination. Diagnosis. Treatment. Bone marrow transplants are currently the only treatment.